So most of us are having issues, right? And sleeping well at night. I know I have been stressed and anxiety with COVID, all kind of things going on. But that's the topic we want to bring today, right? From Dr. Adele. She's joining me. She joined me in our studio. She is a naturopathic doctor as well as a licensed acupuncturist who is based in South Africa in Cape Town. All the way from there, we are going to learn how to sleep better. Welcome, Dr. Adele.
Hi, welcome. And I know it's morning there for you guys, or sometime during the day. It's getting quite dark here now. It's our nighttime. Okay, so all I really want to do is just very briefly touch on a few things today. I'm hoping to expand on this when I do a course on the different areas relating to stress and anxiety. So I thought I'd just go through a couple of myths behind or myths around sleep and debunk some of those. Okay, so most people think that you can sort of train your body to sleep less than about 7 or 6 hours. So some people can manage that fine, and they think that it's okay, and it's going to be something that they can cope with for the rest of their life, or if they're in a very busy time, they can do that. But basically, we do find that we can adjust to sort of sleep deficits, and the circadian rhythm can adjust slightly, and it's very much based on your genetics as well. Some of us are night owls, and some people are, like to go to sleep early, wake up early, but you can train yourself. But the concern is that if we don't get 7 or actually 8 hours sleep on average, that we are actually doing our bodies harm. And the studies and this research, nice new research in 2019 has come out as well, that there is really, if you're looking at habitual short sleep duration, that it really increases cardiovascular risk, metabolic risk, mental and immunological health disorders are also very strongly linked to a lack of sleep. So catching up with a nap in the daytime, if you've really had a bad sleep, or a short course of a night of a couple of bad sleeps, a nap during the day can actually be be beneficial for a lot of people. Just a word of caution: if you struggle to fall asleep at night, then sometimes the napping can cause a bit of an issue. So the myth about you can get by with less than 5 or 6 hours sleep a night on a regular basis is not true. That has been debunked by research studies, and the science is out there clear as day. And what's interesting is that there's a lot of perception with a lot of people about, if I'm working late or hard hours and I'm not sleeping, I'm only sleeping 5 hours a night, it's almost like a bit of a badge of honor that some people try and wear that to say, like, I'm working so hard, I'm super special. But actually, that I see the tide is starting to turn a little bit, especially with some of the celebrities out there. Gwyneth Pelteret is one of them, sort of promoting clean sleeping or clean sleep, like clean eating and clean living. It's actually just another word for sleep hygiene. And that's what I do with a lot of my patients, is actually analyze and go through it in detail. How are you sleeping? The hours, when are you going to sleep? A whole range of just different things, which encompasses this terminology or this term called sleep hygiene. So it's another myth that I would like to debunk is that if you go to sleep many hours before, at least 2 hours before midnight, you're actually going to get better sleep. Now, again, it's based on the genetics, though, Amita. So I do find that some patients sleep are better at going to sleep later and waking up later. They actually function better. And if we look at their genetics, that clock gene is there often with quite high variation there. Whereas other patients, I do find it better going to sleep earlier and waking up earlier. And regardless, really, of when you go to sleep, the sleep, or what we call the sleep onset or time of sleep onset, basically, your deepest sleep is going to be in your first 1 or 2 cycles. So it doesn't matter if you're going to bed at 9. It's those first 1 or 2, or actually sometimes even 3 cycles that are going to be where you get your deepest and most restful sleep. So it's the delay in that sleep onset time is not really a concern as long as you're getting those deep cycles. Okay. But we do find with teenagers, they are delaying that sleep onset a lot, and by using those electronics, screen time tends to be a problem, and that does have an impairment on performance and mood changes and difficulties concentrating as well. So it's not a one-size-fits-all package. Okay, so we've got to adjust it and personalize it. That's what natural medicine and functional medicine is all about, is personalizing and individualizing for each patient. Another myth that I'd like to debunk is that good sleepers never wake up during the night. Okay, that's not true at all. So we all, it's normal to actually wake up. But the problem is, if you're waking up and you are not then able to go back to sleep quickly, that's where the problem lies. So if you're lying awake and you start worrying and start being anxious and stressful about different thinking, stressful thoughts or overthinking certain things, that's potentially where the problem lies. Okay, so we are normally waking up on a regular basis during the nighttime, but we should be going to sleep quite quickly again after that. And then another myth I'd like to debunk is that your dreaming sleep is your deepest sleep. Okay, now actually your dreaming sleep isn't your deepest sleep. So I always say to patients, it's really you are functioning in almost like you're awake, but you're paralyzed. That's what a dream state is all about. Sometimes people get up and sleepwalk as well. So it's not a one size fits all again, but it really is, you're doing a lot of processing, transferring of information and storage of information when you're dreaming. So it's a critical part of your sleeping process. And we do find some patients that are have a deficiency in some of the B vitamins, can't really recall their dreams. Particularly B6, we find is a deficiency in some of those patients. And then often hear patients, I'm in my 80s, I shouldn't be sleeping that much. I don't need as much sleep. And we do find that as the older we get, that we do get a more fragmented sleep pattern. And the sleep quality is sometimes reduced in older patients, but it really is very impactful that we're getting enough overall in our 24-hour day or cycle. So there are often other health conditions that affect the elderly patients as well, or not even elderly patients, but if you've got a sore back, or you've got a sore shoulder, or you've got a struggling with some other health issues, we can find that is affecting your sleep as well. And we find that as you get older, we tend to be a few more other affecting health conditions that could cause problems as well. And then another one that a lot of my patients
here.
a lot of my patients like to sort of say, but can't I just have a little nightcap, like a little bit of an alcohol drink, a little tot of something to just help me go to sleep? It's called a nightcap anyway, so surely it should be helping me to go to sleep. But the science is out, people. I'm sorry to say that alcoholic beverages before bed do induce a more unhealthy state of sleep. So it does actually reduce that deep state of sleep. So I'm sorry to say that an alcoholic beverage before bed is not going to help as much as you would like it to. Yes.
You're reducing the sale of all the nightcap liquor companies here.
Yeah, so I'm afraid the new research is out, and it's definitive. It definitely has an impact on. So it might help you with your sleep onset. You might fall asleep a lot faster, but you're going to have a much less deep sleep. The quality of your sleep is going to be less. And what about snoring? Snoring is harmless. It's nothing wrong with snoring. And in some cases, there is nothing wrong with snoring. But generally, we do find that patients who snore very loudly, there could be some, not only is it disturbing your partner or somebody else in the bed, in the room that's with you, but it also could be a sign of sleep apnea. And the apnea is a restriction in oxygen flow. So we could even get a hypoxic state where for a little while we actually stop breathing. and it could trigger a whole range of other health disorders and issues as well, and and heart problems as well. So we're looking at severe cardiovascular issues developing from that. And I often find just a slight change in the ergonomics around the sleeping, your bed, your pillow, the cushions, your bed linen, etc., can often have a big, profound effect on that. And also just watching the alcohol intake before you go to sleep, that can often trigger some of the snoring. Definitely red wine can be a bit of an issue.
Okay.
So those are some of the myths really around sleeping that I thought I'd just sort of mention to a lot of people. And the understanding is that some of these sleep issues can be quite severe on your health going down the line. So it really is, chronic insomnia. I'm not talking about major disorders and things like that. I'm just talking about generally being a little bit on the stress side, and then what can we do to actually support the process of going to sleep and sleeping through and having a good quality sleep at night. And that's what I'm hoping to do in my course going forward, in giving some more details on that part, and looking at the nutritionals, the herbals, the botanicals, looking at essential oils, looking at progressive relaxation, looking at a variety of different techniques, acupressure stuff that I can easily teach people to do on their own. Doesn't require a lot of money, and it takes a little bit of time. It takes a bit of like self-discipline, takes a little bit of planning, a couple of changes to your schedule at night maybe, can make a huge difference in just affecting your sleep and the quality of your sleep. That's what's so important as well. So I don't know if there are any questions out there or.
Sure, someone commented, nice. Well, if someone has any questions, we can take your questions. I see people are watching live right now. So if there is any question, we can take them. That's not an issue. The idea is, I mean, the what we're trying to bring is that sleeping, don't wake up till 2 o'clock and watch all your videos and get used to your phones and sleep at 2 o'clock and then wake up at midnight, right? I mean, a lot of teenagers, young people, they do that, right?
Yes.
Point,
and
right?
that we find that is often maybe a link to something like a liver disorders or some detox issues. 2 o'clock to 4 o'clock wakings can often be related to some kind of underlying health issue as well. But it often is just a lot of these thoughts and concerns, there's anxiety, a lot of things going on. I call it my washing machine brain when I talk to patients. So there's stuff going sloshing around in your brain, and you wake up, you might have to get up to urinate once or twice. And going back to sleep with this washing machine brain is always a problem. And then putting that screen on with all that blue light, that's really going to negatively affect you as well. So just be cautious with that. And I've got, light therapy training and teaching people how to, change the way they, and there's glasses that you can wear, and there's different meditations and things you can do as well to really support that, but more red light rather than the blue light. Yeah.
So let me ask you a question. So is it normal, like a lot of people wake up at night to go to the bathroom? Is that normal, or is that also not recommended?
It varies. Obviously, if there's some underlying bladder issue, incontinence issue, or a UTI sort of infection, it's understandable why something like that would happen. Often in older women, and particularly women, but also in men, there could be slight incontinence issues as well. But in general, if you are doing a lot of liquid before you go to bed, it's understandable why you're going to wake up. Okay, so your bladder will be full and it will wake you. So the idea is not to do too much liquid too late at night if you don't want to be woken up by your bladder. So, but of course, we've got to look at each individual and see what the underlying issues are, if there are anything.
Sure. Well, I think this is a great intro to all the myths that you talked about for sleep, and we know that there are a lot of other issues that could impact the sleep, like anxiety and all kind of issues, right? Like COVID now. I mean, relationship issues. There are so many reasons that could impact,
Absolutely.
right?
Yes.
It's not just one thing that,
No,
okay.
there are thousands of different things. And I always say to patients, think of, each individual is an individual million-piece puzzle, and each piece in that puzzle has a different impact on your
Mhm,
puzzle as a whole.
mhm,
So
mhm.
sometimes the puzzle's missing, sometimes there's a puzzle that's got a little piece that's bent, and we have to try and straighten it and get that back in, or, so there are many, many factors that we have to look at. And of course, stress and anxiety is playing a huge role in everybody's lives at the moment, particularly with lockdown and with the concerns about health and financial concerns, etc. So it's a bigger picture. This is, the idea of some ideas of sleep hygiene, etc., are not, it's not a magic bullet that's just going to make everything right. It's just supporting your body as optimally as possible, and going through maybe a little bit of a ritual, and changing the when you're eating and what you're eating, and the temperature in the room and the light that you're exposed to, and doing some breath work and maybe some acupressure or acupuncture on yourself, can just support the process. And that's what it's about, is that I'm here as a guide and a support for my patients. I
Sure,
can't
sure.
magically make things
Of
better.
course.
So it's a guiding process, and it's a team effort, and there are many factors involved. Yeah.
Sure, sure. We have a question, Dr. Adele. So June is asking, what do you do when you cannot fall asleep at 2 in the morning? Should one get up, or should you stay in bed until you eventually fall asleep?
Okay, so there are various theories around that. There are what we call sleep restrictive therapy, which is a behavioral treatment that we use with patients. A lot of the time, if it becomes habitual, then we would often recommend you actually do get up, go somewhere else completely, and do something calming and relaxing until you start feeling sleepy again, and then get back into bed. And again, I must reiterate, it does vary per patient, because depending on what the cause is, we always got to look at what the root causes are. If there's some underlying pathology, or like a liver disorder, dysfunction, detox processes not happening, we've obviously got to address it from that perspective first, and see if there's anything going wrong on that side. But yeah, we often find that it's actually better to just get up and go and do something else, because there's another myth about just lying in bed and with your eyes closed is just as good as deep sleep. It's not.
Okay, okay. So you
Yeah.
should get up and kind of walk around a little
Yeah,
bit.
if it becomes a regular thing, it's a good idea to actually, because what can happen is we can develop a bit of anxiety about falling asleep, and so that it becomes sort of a bit of an imprint in the brain that when you are lying in bed, you've got this, what happens if I wake up again at 2 and I'm going to lie here all night? I can't sleep for the next 2 hours, whatever. So it's your bed must be your haven, your safe space. That's where you sleep. And if you're struggling to sleep, then rather get up and do something else until you feel sleepy, and then come back to your safe space where you are going to sleep. But it might take some therapy treatments as well. And just remember, for my ladies out there, especially going through menopause, you could be that there's estrogen or progesterone deficiency, which can also aggravate sleep latency, as well as sleep, not just onset, but the latency part of it. Yeah. So
Well, hope you answered the question, June. If you have any comment or feedback, you're welcome to put it again. Any other questions from anyone else? We are coming up with the course. Dr. Adele is putting together a beautiful course that would help all of us, at least self-learn about anxiety, how to calm ourselves, and how to sleep better. So Dr. Adele is doing that as we speak, and hopefully in a month's time, right, Dr. Adele? We
yes,
should be.
I'm hoping for a month's time. Yes.
Okay. Any other comments before we wrap up? Any feedback? Anything else? Okay. Anything else from you, Dr. Adele, before we wrap up? This is an amazing session. I think you just went through 1, 2, 3, 4, 5, and I think it was very, very.
Just quick. Okay, so I just want you to always remember the 5 senses have a big role to play in not just sleep, but in all issues, but particularly when it comes to sleep. Think about your 5 senses before you just setting up your bedroom, light, bed linen, your pajamas, temperature, whether people are bouncing around on the bed or animals are bouncing around on the bed and you try to sleep. And smell, even though smell isn't affected by while you're sleeping, you can affect a great sleep through smell, through your sense of smell, through diffusing essential oils, etc., breathing through the nose and out through the mouth. So breath work can be fantastic as well. So just as a quickie, like a little teaser, just think of your 5 senses. I'll be going through those in more detail in my course as well.
Okay. Well, thank you so much, Dr. Adele. Amazing session. And acupressure, essential oils, there's so many different techniques, like you said, that can help all of us with better, help to calm us down and better sleep. With that, hopefully you guys can sleep better, right, tonight. and thank you so much for your support to everyone.
Thanks,
Okay.
Anita.
Bye-bye.